Our dogs are family, but they can't tell us when something's wrong. Instead, they communicate through subtle changes in behavior and body language. Today, we'll reveal 16 warning signs your dog is silently begging for help, clues every dog owner needs to know. Noticing that your dog suddenly loses interest in food can be alarming. A sudden loss of appetite is a major red flag that pet owners should never ignore. Dogs are creatures of habit, and eating is a natural daily routine for them. When they turn away from their food, it's often their way of telling you that something isn't right. Dogs are hardwired to eat. When they refuse food, something's off. This behavior can be a sign of a wide range of issues, from minor to serious. Sometimes it's as simple as a change in their environment or routine, but it can also signal underlying health problems. It could be pain from dental issues, such as a broken tooth or inflamed gums, making eating uncomfortable. Illnesses like infections, digestive problems, or even more serious conditions like kidney disease can also cause a dog to lose interest in food. Stress and anxiety, perhaps from a recent move or loud noises, can also play a role. If your dog skips a meal but seems fine otherwise, still playful, alert, and acting normal, monitor them closely for the next 24 hours. Sometimes, dogs just have an off day, just like people do. But if the loss of appetite continues for more than a day, or if it's paired with other symptoms like vomiting, diarrhea, lethargy, drooling, or noticeable discomfort, it's time to take action. These could be signs of a more serious health issue that needs prompt attention. Don't ignore this sign. Consult your veterinarian if your dog's appetite doesn't return or if you notice any other worrying changes. A professional can help identify the cause and recommend the best course of treatment. Early intervention can make all the difference in your dog's recovery and overall well-being. Acting quickly can prevent minor issues from becoming major health problems. Remember, your dog's refusal to eat is a clear message. They need your help and attention. By staying observant and responsive, you can ensure your furry friend stays happy and healthy for years to come. Licking and chewing are natural behaviors for dogs. They often use their tongues and teeth to groom themselves, clean their fur, or even soothe minor irritations. It's a part of their daily routine and usually nothing to worry about. However, when you notice your dog constantly licking or chewing the same spot, or if the behavior becomes obsessive and hard to interrupt, it's a clear warning sign that something isn't right. This isn't just normal grooming anymore. It's a signal that your dog is trying to tell you something. Common causes for this behavior include allergies to food or the environment, parasites like fleas or ticks, or even hidden injuries that you might not see at first glance. Sometimes, a small cut, thorn, or splinter can cause persistent discomfort. But it's not always physical. Dogs can also lick or chew excessively when they're feeling anxious, stressed, or simply bored. Changes in their environment, lack of mental stimulation, or being left alone for long periods can all contribute to this behavior. Take a close look at the area your dog is focusing on. Check for signs like redness, swelling, sores, or patches of hair loss. These symptoms can help you identify if there's an underlying medical issue that needs attention. Also, consider your dog's daily routine. Are they getting enough physical exercise and mental stimulation? Sometimes, simply increasing playtime, walks, or providing interactive toys can help reduce this behavior. If you've checked for obvious causes and the licking or chewing continues, or if you notice wounds that aren't healing, it's important to consult your veterinarian. Persistent licking can lead to infections or worsen existing problems. Remember, excessive licking is your dog's way of coping with discomfort, whether it's physical pain or emotional distress. It's their way of asking for help. Don't dismiss this behavior as just a quirky habit. It's a sign that your dog needs your attention and care. Take the time to investigate and address the root cause. Your dog's health and happiness depend on it. If your dog suddenly becomes aggressive or unusually irritable, it's important to take this behavior seriously. Sudden changes in temperament are often a sign that something is wrong and should never be ignored or dismissed as just a bad mood. Dogs don't have words to tell us when they're hurting or scared, so they use body language and sometimes aggression to communicate pain, fear, or insecurity. This can look like growling, snapping, or even just avoiding touch. Often, pain is the underlying cause. Conditions like arthritis, injuries, or hidden illnesses can make even the gentlest dog lash out. Watch for limping, stiffness, or changes in how your dog moves. But it's not always physical. Anxiety, fear, or confusion, especially in new environments or around unfamiliar people, can also trigger aggressive reactions. Dogs may feel threatened or overwhelmed and act out as a way to protect themselves. It's crucial never to punish a warning growl. Growling is your dog's way of saying, "I'm uncomfortable." Punishing this warning can make your dog suppress their signals, which may lead to more dangerous behavior later. Instead, take a step back and observe carefully. Try to notice when the aggression happens, what triggers it, and how your dog's body language changes. Keeping a journal can help you spot patterns. Always consult your veterinarian first to rule out pain or medical issues. If your dog gets a clean bill of health, a professional dog trainer or behaviorist can help you address behavioral causes and create a plan for recovery. Remember, aggression is not bad behavior. It's a plea for help. Your dog is trying to tell you something important about their well-being. Stay calm, patient, and observant. Reassure your dog with gentle words and avoid escalating the situation. Acting quickly and compassionately can make all the difference. With the right response, you can help restore your dog's sense of safety and trust, strengthening your bond and ensuring their happiness. Dogs love to nap, but persistent lethargy is different. It signals illness, pain, or even depression. If your energetic dog suddenly loses interest in play or can barely get up, something's wrong. Infections, heart disease, metabolic issues, or emotional distress can all drain their energy. Don't assume it's just age. Healthy seniors still enjoy life. If lethargy lasts more than a day or is paired with other symptoms, see your vet. Lethargy is your dog's way of saying, "I need help." When dogs hide or withdraw, it's often instinctive. They're protecting themselves from pain or stress. If your social dog suddenly seeks solitude, pay attention. Physical pain, illness, or deep anxiety can drive this behavior. Don't force them out. Approach gently and investigate the cause. If hiding becomes constant, it's a sign of distress. Your calm presence and action can restore their sense of security. Always look for the root cause. Panting cools dogs down, but heavy panting at rest or in cool conditions is a warning. Pain, anxiety, or serious medical issues like heart or respiratory disease can cause this. Excessive drooling, especially if sudden, may signal nausea, dental problems, or poisoning. Check the context. If it's not hot or after exercise, be concerned. Look for other symptoms and consult your vet if it persists. These are not subtle signs. Respond quickly. Accidents in a house-trained dog are rarely behavioral. They're usually medical or emotional. UTIs, kidney disease, diabetes, or anxiety can all disrupt bathroom habits. Changes in stool or urine, straining, or increased frequency are all red flags. Never punish accidents. Observe and document details for your vet. Sudden changes are your dog's way of saying something's wrong. Act promptly to find the cause. Dogs communicate with their voices. New or increased whining, yelping, or howling signals distress. Pain, anxiety, loneliness, or confusion can all cause vocal changes. Don't dismiss it as attention-seeking. Look for patterns and triggers. Check for pain or unmet needs. Persistent vocalizing is a direct plea for help. Listen, observe, and respond with care. Rapid weight changes without a change in diet or exercise are major warning signs. Weight loss can signal parasites, diabetes, thyroid issues, or cancer. Weight gain may point to metabolic or organ problems. Notice if their collar fits differently or if they look bloated. Don't ignore these changes. Track them and consult your vet. Weight shifts are visible signs of internal trouble. Early action can save lives. Constant scratching or bald patches mean your dog is uncomfortable. Fleas, mites, allergies, or even hormonal imbalances can cause this. Check for redness, swelling, or patterns of hair loss. Persistent itching leads to infections and misery. Don't just treat the symptoms, find the cause. Your dog's skin is a window to their health. Limping, stiffness, or reluctance to move are clear signs of pain. Arthritis, injury, or even something stuck in their paw can be the cause. Watch how they move and gently check for sore spots. Never force a dog to move if they're in pain. Mobility changes are urgent. See your vet for diagnosis and relief. Movement is joy for dogs. Don't let pain steal it. Act quickly to restore their comfort. New lumps, bumps, or swelling should always be checked. Most are harmless, but some signal infection, injury, or cancer. Note the size, location, and if it's painful or growing. Regularly feel your dog's body for changes. Early detection is key. Consult your vet for any new growths. Your hands can catch problems before they become serious. Persistent bad breath is a sign of dental disease, not just doggy breath. Plaque, tartar, and gum disease cause pain and can lead to organ damage. Check for red gums, loose teeth, or difficulty eating. Dental health affects the whole body. Don't ignore it. Regular brushing and vet cleanings are essential. Bad breath is your dog's mouth asking for help. Clear eyes and a clean nose are signs of health. Persistent or colored discharge signals infection, allergies, or injury. Thick yellow or green discharge is especially concerning. Note which eye or nostril is affected and any other symptoms. Don't use human medications. See your vet for diagnosis. Discharge is a visible sign your dog needs attention. If your dog suddenly drinks and urinates much more, it's a red flag. Diabetes, kidney disease, or hormonal disorders are common causes. Track water intake and bathroom frequency. Never restrict water. Seek veterinary advice immediately. Excessive thirst is a silent scream from your dog's organs. Act fast to protect their health. A sudden change in your dog's bark or breathing is serious. Hoarse barks, wheezing, or labored breathing can signal airway or lung problems. Listen for new sounds. Rattling, crackling, or rapid breathing. Difficulty breathing is an emergency. Don't wait. Your dog's voice and breath are vital clues. Respond immediately to any changes. Your dog depends on you to notice these silent pleas for help. If you spot any of these signs, act quickly. Your vet is your best ally. Share this knowledge to help more dogs live healthier lives. Thank you for caring and for being the leader your dog needs. Stay observant, stay compassionate, and keep learning. Your attention can make all the difference in your dog's life.